Are you dealing with stubborn Achilles pain? In this video, I'll share 6 targeted massage and stretching techniques to relieve tension and support your recovery from Achilles tendonitis. Number 1, we're going to do some effleurage or some warm-up techniques. So even though we're thinking this as an Achilles tendonitis, or a tendinopathy, we want to be doing a thorough warm-up of the calf muscles. And if you don't know about your calf muscles, I've got a great video to show the anatomy of where they are. So we're doing effleurage techniques here, doing reinforced effleurage. I'm just giving you a quick insight into the techniques, but you would do each one for a lot longer to get them nice and warm. You can do a bit of forearm effleurage, so not a lot of pressure on this one, but it gives your hands a little break as well. Number 2, we're going to do some Petrissage, which we can do some kneading here. Again, 2 heads of the gastrocnemius. And if my client just tries to contract here, we can see the medial head go the other way. That's it, the medial head there, and relax. Okay, good definition there, but we're working on the main belly of the muscle for this. And then we can come down and do some kneading around that Achilles tendon. Kind of like a mini kneading technique, but a lot of people when they're working on the lower leg don't really work on the Achilles, and it does feel really good. I will say, if it is inflamed and sore, we're not going to be doing these techniques on it. So it is in recovery, or it could be an old calf strain, but as long as there's no heat or inflammation in this area. Number 3, we're going to do some lengthening. So I'm going to just perch up on the couch here. I'm going to see what my client's range of movement is like, which is really good. I'm going to move up a bit. So we're going to go from a pointed foot to a dorsiflex foot. And at the same time, I'm going to control the movement. My client tries to relax. At the same time, I'm going to do an effleurage du poing technique. So I'm going down the lateral head. Okay, try and get the techniques in time together. By the time you get to the back of the knee, just below the back of the knee, we're in full dorsiflexion. You can see the foot there in a dorsiflex position to stretch the calf. So with Achilles problems, working on the flexibility, trying to decrease that tension in the calf muscles will help the issue. Number 4, we're going to do a soft tissue release known as STR, or some people will call it pin and stretch. So what we're doing this time, I'm going to again get up on the couch here. So with my client in a shortened position, I'm going to put a lock. Now where the Achilles finishes around here before the big bellies of the gastrocnemius kicks in. So my first point is going to be there, and then I'm going to get the client, or I could help as well, to get them into that stretch. So the stretch goes right through that Achilles tendon. And then I'm going to do a point here, and then I'm going to do a point here. So I do 3 points for a soft tissue release. So we'll go from plantar flexion, hold that for me, hold that there, that's it. I'm going to get some body weight behind it. It needs to be enough. And slowly, if you go into dorsiflexion or go to a stretch, okay, they hopefully will feel, go on, keep going, a stretch from there all the way down through the Achilles. So that'll be my first one, relax. The second one we're going to do here a little bit lower down. Okay, same thing. And go to dorsiflexion. So we get the stretch right through the Achilles tendon. Brilliant. And we're going to do one more. Okay, so the stretch will just go from there to there. So I'm going to pin, and she's going to stretch. That's great. And after any deep work, just relax here. Let's just soothe off as well. Number 5, we're going to do frictions around the Achilles tendon. If they've got inflammation around this area, don't do this one. We want to avoid it. If it's inflamed, we would work more up here. But I'm going to lift the foot up. Okay, and you're going to work with my thumbs around that Achilles tendon. If you don't want to use your thumbs for techniques, we can replace that with fingers. So depending on what you want to use, so work around there. And then what we can also do in this position, just put the leg down and relax, is do a bit of a kneading. It's called an S-shaped kneading technique, where I push and pull like that. And can we see the bend in the Achilles tendon? So that's really effective at just trying to get that to lengthen if possible, rather than just working on the calf muscle. Okay, and I'm going to soothe off before we move to our stretch at the end. Number 6, we're going to finish with a muscle energy technique, or MET. So I'm going to be stretching the gastrocnemius for this one. I'm going to take the bolster out, get my client to shuffle down so their feet are dangling off the end. Let's just see what's going on here. Good. Okay, come down a little bit further. Brilliant. So gastrocnemius, knee straight, and I'm going to use my thigh now to take her into a stretch. Try and relax for me if you can. That's it. Good. So with a straight leg here, we're going gastrocnemius. If I want to do this on soleus, I would have a bent knee. Hold this for 10 seconds. After 10 seconds, the client is going to push their toes into me, brilliant, which contracts the gastrocnemius. And we're going to do that for 10 seconds and relax. And now take it a little bit further. So that's step 1 of our MET. Hold for 10. Then just going to push for 10. Okay, about 20%. We don't want too much. That's it. And once she relaxes, you should feel that you've got a little bit more mobility and can go a little bit further. So that's my second step. Hold this for 10. Then we're going to push for 10. Plantar flex. Again, and we're doing it a bit faster than you will be doing it. Please hold it for the full 10. Relax. Last one, let's take it right up to the end there and hold that last one for 30 seconds. And that would be a great way to finish and increase flexibility of the calf muscles.